We have 4 major sites in this trust, out of which 3 sites do both trauma and elective. Now, trauma is your broken bones in general, involved in accidents. The other group is elective orthopedics, which essentially is hip, knee, planned surgery like replacements or stabilization operations or ligament reconstructions.
Previously, there was a huge amount of cancellations of all the joint operations because these are seen as non-emergency operations and they would be the first ones to get displaced from an operating list when there are other pressures on the hospital.
Now, what we propose as a team to do is separate trauma and elective work, and by doing this segregation or by carrying out this segregation, we strongly believe that the patient cancellations can be reduced to a very, very bare minimum. And that is how I think, by and large, this service will improve patient care, treatment, and experience.